are the nation, we are
Good afternoon, everybody. My name is Olamide from Top Cancer Nigeria. Top Cancer Nigeria is a voluntary organization that was set up by young doctors and medical students with adequate supervision by medical consultants. We deal majorly with cancer awareness, education, and training. Today we will be talking to you about cancer in Nigeria, early detection and prevention. Is that there's an abnormal growth in your body which has a tendency to spread to other parts of the body. However, if we are talking about swelling generally, we have benign swellings which are swellings that do not spread to the other parts of the body. On the other hand, we have the ones that do spread, which are the ones called cancers or malignant cancers, are still largely unknown. But we have some things we call risk factors. These risk factors are occurrences that increases the tendency of having cancer. The first thing is age. The older you are, the more it is, the more tendency for you to have cancer. Then we have our environment. There are some things our environment gives us that can predispose us to having cancer. Things like irradiation. When you are exposed to so much radiation, things like chemical exposure, there are some chemicals that have been associated with some type of cancer. Air pollution. These are so many things, environmental factors that can predispose us to having cancer. Then we have our lifestyle. Alcohol, smoking. The more medicine, the more you stress yourself, the more you put room for the replication of cells that are common in Nigeria. The first on the list is breast cancer. Followed right behind it is when you have a lump in your breast, you have to check it. When you have blood in the fluid discharge, you have to check it. When you have changes in the skin over your breast, you have to go and check it. When you have your nipple retracting, that means your nipple going inwards instead of the normal outward protrusion, then you have something addressed by ourselves. I'm going to simplify it into 6 methods. The first 3 methods you are only going to look. The last 3 you are going to feel. This is very essential for our females. So I'd like us to really pay attention and follow it. Because cancer happens to the rich, to the young, to the old, to the poor, to everybody. Nobody should be exempted from knowing these things. It is when you know it that you can detect cancer early. So the first method, you are standing in front of the mirror with your hands by your side. You look at your breast. Are there any changes? Can I see anything that was not there before? Is the breast bigger than the other one? Is my nipple showing any abnormality? You look. Then place your hands behind your head. That is step 2. You look again to see if there are any changes, if there are any abnormalities. Step 3, your hands in a pinball. You check again any changes, any abnormalities. Then step 4, now to the feeling. You use your right hand, place your right hand behind your head, and use your left hand to palpate your right breast. The left hand to the right breast, the right hand to the left breast. And to make it simpler, you divide your breast into 4 quadrants. That's 4 equal parts. The upper outer, the upper inner, the lower inner, and the lower outer. That makes it easier and that makes you certain that there is actually something there or there is nothing there. So you can feel your breast gently but firmly to ensure that there is nothing that you are missing. If there's any lump, then you have to go to your doctor immediately. If there are any changes, you have to go to your doctor immediately. Then step 5, you gently squeeze your nipple for any discharge whatsoever. Then step 6, you lie down and you feel your in that kind of a situation, it's advisable that such individuals go for screening in that particular cancer, like for cervical cancer, you go for cervical examination. condition like the one that we demonstrated the other time. Okay, now for lifestyle modifications, smoking. Some of us eat junks. You know, we are always at Mr. Biggs, we are always at all these eateries. But really, all these things, they are just killing us. That's the simple truth. We are thinking we are enjoying ourselves, but after the water. You know, the food that we eat, we should do regular exercises. I know some of us don't do exercises up until when we go for this camp. And then you're like, we don't want to finish this 3 weeks or how many weeks and just go. But the truth is, the little exercises that we've been able to learn here, we can just do them on our own. Early in the morning, 10 minutes, 15 minutes before we start and dressing up for work.
This is what we do. We do our research for that. Following us from Twitter at Podcast Community. That's CRD. Then follow us on, also like our page on Facebook. That is www.facebook.com/ComCancerNigeria. You can follow us. We have a lot of information. If you have questions, you could also ask us. And you give us suggestions and comments about our presentation.
The future is here. The future is here.